and welcome to Wellness Live. My name is Dr. Olivia Moses, and Wellness Live is brought to you by Loma University Health's Living Whole Wellness Program. We are so excited that you've joined us today, and today we have a very special topic. And this topic is actually important probably to all of us. So when I say the word pharmacist, what pops into your mind? Well, it might be an old-fashioned definition that you have in your mind about a pharmacist, and things have changed. So today we have the Dean of our School of Pharmacy here, Dr. Michael Hogue, who is here to talk to us about knowing your medicine and knowing your pharmacist. Well, welcome, Dr. Hogue.
Thank you very much, Dr. Moses, and I hope that folks will find this an engaging presentation today. I'm going to start today by sharing a little bit of information with you about pharmacists and their background and training. I think that that's perhaps something that you may not be as familiar with as you once thought you were. And then we'll talk about and get into the nitty-gritty of why knowing your pharmacist a little more personally might be just what you need and might in fact save your life. Our objectives today are to describe the education and training of a pharmacist and how the profession has changed over time. We're going to talk about some really major issues with medication safety that we see in the United States, and we'll talk about some of the current myths about how your insurance company is supposedly protecting you from those harms, but in fact, insurance companies are not healthcare providers, and so you have to rely on your physician and your pharmacist to help you with that. And then we'll talk about some strategies that you as consumers can use to be able to get the most out of your medication, because we're spending a lot of money in the United States on medications to help us stay well, and we want to make sure that those medications are doing what we're supposed to do. Well, one thing that has changed in pharmacy education and in a lot of healthcare professional education over the last 10 years in particular is the fact that many of the health professions have changed to doctoral level training. Now, some of you may be aware of this, but now when you walk into a hospital or a healthcare environment and you ask to speak to your doctor, it's a little confusing as to exactly who it is you want to speak with. In the past, we used to always think that it's our physician that we want to speak with, but there are a lot of doctors in the healthcare environment now. Your dentist is a doctor, your podiatrist is a doctor, your optometrist is a doctor, your physical therapist is now a doctor, your nurse practitioner is a doctor, your psychologist or psychiatrist may be a doctor. In fact, you take your pets to a doctor of veterinary medicine. And guess what? Your pharmacist is also a doctor. Since 1998, the Doctor of Pharmacy degree has been the entry-level degree in the profession of pharmacy. So now over 60% of the pharmacists who are in practice actually are doctors. So there are a lot of people in the healthcare world now that hold a doctorate degree. So that's important to know. You should also know that your pharmacists do a whole lot more than just learn chemistry. I think a lot of people, their image of pharmacists is that we compound and put together medications, and that we take the medicines that are made by manufacturers and we supply medications to individual consumers based upon a prescription from a prescriber. And that is a little bit of what we do. But that intensive background in pharmacology, drug dosage forms, medicinal chemistry, how medicines work in the body, we call that kinetics and dynamics, how those work in the body, those are very important areas of study and their foundation to pharmacy. In fact, pharmacists receive more training in those sciences than probably any other healthcare professional. But you may not know that your pharmacist actually has been trained to do a head-to-toe physical assessment. They learn how to do physical assessment. They learn about laboratory analysis because those laboratory markers tell us whether or not a drug is working the way it's supposed to in your body. And so pharmacists are trained in that. They're also learned in therapeutics and trained very deeply in therapeutics and in drug therapy monitoring. And that's a pretty big deal. A full 1/3 of the curriculum in a pharmacy school now is hands-on patient care, direct patient care, so that your pharmacist is working alongside physicians, nurses, and other members of the healthcare team to ensure that you, as a consumer, are getting the very best healthcare that's available. Interprofessional or team-based care is really important here at Loma Linda University, and it's very important in healthcare generally. In addition to that, nearly 1/3 of the graduates from pharmacy schools today complete a residency program. Residency programs have been around in medicine. Nearly 100% of physicians complete residency training. But you may not have been aware that pharmacists also now are increasingly completing postgraduate residency training. And why do I tell you all of that? Because the pharmacist is taking care of more than just putting the medicines in a bottle, which may be the perception of what you see at your local community pharmacy, and that's an important thing. The right medicine at the right time is a critically important thing. But medicines have become much more complex, and the conditions and our understanding of how diseases affect us has changed, and we've learned more over the years. So pharmacists use an intensive care process that is a very intentional process to be able to ensure that we're collecting information about patients, we're assessing that information, we're working with the other members of the healthcare team to make appropriate plans to ensure that the medicines are doing what they're supposed to do. We implement those plans and then follow up and monitor. At the center of everything that pharmacists do, you, the patient, the consumer, are really at the center of all of this, because this is your care. And we want to make sure that you get the most out of your care. Now, where do pharmacists work these days? Well, I can remember when I was a young boy growing up in the farmland of southern Illinois, I only knew one pharmacist, Eric. Eric was my pharmacist. He worked at the drugstore in our small town in Illinois, and I had a great relationship with him. I remember going into the pharmacy and getting a cherry Coca-Cola after basketball practice, and Eric was there, and my mom trusted Eric, and Eric always had a lot of answers to her questions. That is a wonderful picture of what pharmacists do, especially in the community setting. They have great relationships, and they really help individuals get the best use of their medicine. Community independent pharmacies represent about 20,000 pharmacies in the United States. Many of us now think about the large chain drugstores like CVS and Walgreens and Rite Aid and Walmart. Those are large pharmacies, and many of us interact with those. Grocery stores like Albertson and Vons and Publix, if you're on the East Coast, also have pharmacies. Hospitals employ a lot of pharmacists that work on interprofessional teams in the intensive care unit, in the emergency department, in the oncology department, and lots of other specialty areas of practice. Nursing homes have pharmacists, and even in clinics, outpatient clinics, pharmacists work alongside physicians to help ensure that you're getting the very best care that you can possibly receive. Literally anywhere that healthcare is provided these days, you'll find pharmacists. Pharmacists are involved in every one of those teams. Believe it or not, the majority of pharmacists today do not work in a community pharmacy. That's a big change from the past. Pharmacists increasingly are working in other environments outside of the community. That's not to diminish the importance of a community pharmacist in your local community. They're very important to your health. But that's a big change that's happened. The other thing that you should know is that pharmacists, because medicines are becoming more highly specialized and the complexity of medicines for certain conditions are becoming so specialized, that pharmacists now are becoming board certified in specialty areas. Nearly 50,000 of the 350,000 practicing pharmacists in the United States are board certified in a specialty. And there are lots of those specialties. There's 14 of them listed here on the screen, and there is an increasing number of specialties where pharmacists can become board certified. So with that, Dr. Moses, I wonder if we have any questions at all about what the profession of pharmacy is before I jump into
the questions that we're actually getting.
Yeah.
Yes, but I think we have a great set of questions from what you just said. So you said that pharmacists are in a lot of different areas. Now, what is the best way to get in touch with your pharmacist? Is it appropriate to ask for your pharmacist in the hospital? Is it more we have interactions with them when you're a community pharmacist? How would you create a relationship?
Yes, absolutely. Well, if you find yourself being admitted into the hospital for any reason, I can guarantee you 100% that there's going to be at least one and maybe more than one pharmacist involved in your care while you're in the hospital. Your pharmacists do actually come by your bedside and check your medicines. Oftentimes they may do that while you're asleep, while you're resting, and you may or may not be aware that they're coming in. They'll often round with the healthcare team when the team comes in to talk with you about your care. At some point in the day, there's usually a pharmacist in the room. But I would encourage anyone who wants to actually talk with their pharmacist or has questions about their medicines while they're in the inpatient setting to certainly ask. Say, I want to see my pharmacist. I want to talk to my pharmacist, and that's fine. The hospital will provide a pharmacist that will come and speak with you about your medications while you're in the hospital. So definitely something that you can do.
That's great. I want to remind our audience that you have the opportunity to ask Dr. Hogue some questions. Dr. Hogue, you mentioned that with your presentation that there are some specialties, actually a number of specialties that pharmacists go in. So how would you know your pharmacist's specialty? And is that an important thing to ask if you have certain issues that you want to talk about?
Yes, and this is one of the reasons why you really should know the name of your pharmacist and why you want to have that personal relationship with the pharmacist, just like you have that personal relationship with your physician. You've got to realize that the pharmacist's understanding of the complexities of the medications, the side effects that they can cause, and the interactions that they can create is a pretty unique knowledge set that the pharmacist has. So it's important to know their name. Most board-certified pharmacists, if you see their name in print, will have the initials BC followed by additional letters depending upon their board certification to indicate that they're board certified in some area. The area where I think it's perhaps most critical to ensure that you have board-certified pharmacists taking care of you is in oncology, because cancer medications are very complex and can be quite difficult and can create lots of side effects and interactions. Here at Loma Linda, we have an outstanding group of board-certified pharmacy specialists in oncology who are providing care through our cancer centers, and we have a wonderful team of pharmacists that work together to make sure that the medicines that you're receiving in the cancer center are exactly what you need and that they're doing what they're supposed to.
Well, great. Well, with that, let's get to the second half of your presentation.
Absolutely. So what I thought would be very interesting for our audience today is to really talk about where we have major problems that occur with drug therapies in our country, to get you thinking about some of the types of things that you really want your pharmacist to be looking for. So when you go into a community pharmacy to get a prescription filled, whether you're going to a large chain drugstore, an independent pharmacy, or you're going to one of the pharmacies that are owned and operated by Loma Linda University, you want to be thinking about these things. Drug interactions are the biggest problem that we see. There are all kinds of interactions that can happen with medications. There can be interactions with other drugs. There can be interactions with foods that you might eat, supplements that you might take, and in fact, there's some drugs that just do not work with the conditions that you might have, and so it's very important that somebody's looking at that. Some of the other things that are important is inappropriate treatment. So sometimes, because we're in a hurry, we often tend to seek care from multiple different places. I'd like to advocate for just a moment that whenever possible, it's ideal that all of us as consumers have a personal family physician, a personal physician that we know is looking out for us all the time, either in family practice, internal medicine, pediatrics, but we need to have a personal relationship with a primary care physician. But second of all, you need to make sure there's one quarterback pharmacist that's looking out for this, because we see so many different physicians in today's world and different types of providers, we often find that patients are taking drugs for really no medically valid reason, that the medication doesn't necessarily match the condition. We also know that a lot of times patients are unable to take medications for whatever reason, the way that they were prescribed. And then lastly, we know that sometimes you have medical problems that are not being treated enough, that don't have enough medication, that something's missing. So there's all kinds of things that happen, as is outlined on the screen, and you may have experienced one of these situations, but we see these happen very commonly. These are the kinds of things that pharmacists try to keep their eye on and make sure that you're getting the best use of your medicine. We also know that consumer behavior has changed a lot when it comes to getting prescriptions filled. Everything has changed. I mean, Amazon.com now is in the business of pharmacy. They have PillPack, and you can get your prescriptions delivered to your doorstep. CVS Pharmacy has 4-hour guaranteed delivery from prescriptions from their sites. Most independent pharmacies deliver prescriptions, so the convenience of prescriptions has changed. This is one example of something that has changed. Just back in 2009, only about 75% of the prescriptions that were provided to patients in the United States were generic pharmaceuticals. 25% were brand. If we fast forward that to today, it's 97% of generic drugs are dispensed when they're available. We've gone from 75% to 97%, which means that nearly every prescription that's being dispensed today is a generic. That is a huge, huge difference in the world that we live in. The other thing that's changed is that drugs have become, overall, the cost of medications has become more expensive over time. The proportion of adults who spend at least $500 out of pocket represents about almost 10% of the entire population spending at least $500 per year on their prescription drugs. And you say, well, that doesn't sound like a lot. But if you're one of those people, that's a lot of money. 20% of the Medicare population is spending over $500 in out-of-pocket costs. Why do I bring this up? Because the Affordable Care Act, while it did provide prescription drug coverage for seniors, and that coverage didn't exist previously, it was a good thing. The bad thing is that a lot of consumers now are paying actually more money out of pocket for their prescription drugs. Some of those generics are pretty cheap drugs. The cost of generics has gone up, in fact, since the Affordable Care Act was passed and since prescription drug coverage has come into being under Medicare. So lots of things that have happened with prescription drug costs. This has got to change. We all realize this. And one of the reasons you need to have a great relationship with your community pharmacist is that pharmacists can help you save money. If pharmacists know that cost is a major concern to you individually, they will work with you, I guarantee, in the community pharmacy setting to ensure that you're getting the lowest cost option. And they just need to know your concerns. And I know that if you have a relationship with your pharmacist and you know your pharmacist, they're more likely to be able to partner with you and be able to help you find those savings. Sometimes getting your prescription filled off insurance is cheaper than getting it filled on insurance, believe it or not. So, what can you do to help you get the best use of your medicines and to stay safe when you take medicines? First of all, know the name of your pharmacist and introduce yourself to any new pharmacist at your pharmacy. If you go in and the person behind the counter is not the person you're familiar with, be assertive and introduce yourself. It is very, very important. You're not going to interrupt them. Yes, they're busy, but they're there for you and they need to know you. If the pharmacist in your pharmacy is always changing, there's always someone new there, you need to change pharmacies because that's a sign that there's some process issues and staffing issues in that pharmacy, and they may not have all the resources they need to ensure your safety, and safety has to come number one. And so make sure that your pharmacist knows who you are and you know who your pharmacists are. The other thing is, let me really advise you to get all of your medicines filled at one pharmacy. A pharmacist can do their best work in identifying drug interactions and ensuring that your medicines are safe if they know everything that you're taking. And they can't know everything that you're taking if you're getting your prescriptions filled at 2 or 3 or 4 or 5 different pharmacies. So it's really important that you do that. And if you do have to use 2 pharmacies because maybe your insurance company requires that you get certain prescriptions filled through a mail order benefit and the others at a community pharmacy, be sure that that community pharmacist knows all of the medicines that you're taking. Most of us have had the experience when we get a prescription filled at a community pharmacy that someone, usually a cashier or maybe a pharmacy technician, when you're checking out or paying for your medicine, they'll ask you a question. They'll say, "Do you have any questions for your pharmacist?" Let me encourage you that every time that that question is asked, say yes. And here's why. None of us know everything that there is to know about everything. We all have questions, and sometimes things change with our medicines. If you can at least ask the pharmacist, has anything changed with my medicine since the last time I got this prescription filled? That simple question, has anything changed about my medicine, will cause the pharmacist to think carefully about how your medicine was prescribed and will cause your pharmacist to think about your particular situation and your prescription. It tells your pharmacist that you're interested in your own health, and your pharmacist will spend a little extra time looking at your medications. And I really think that's important. You've got to be a good advocate for yourself, especially in this setting. It's a very important thing for you to do, to partner with your pharmacist to say this. So even if it's a brief conversation, no, nothing's changed, everything's the same, you're doing great, stay on your medicines, keep up with what you're doing, that's great. At least you had that contact and awareness with your pharmacist. The other thing I want to encourage you to do is open up those paper bags and plastic bags at the pharmacy. Before you leave the pharmacy, open the bottle and look in the bottle and say, is this pill the same one that I was taking? If you're getting a refill on a medication, that medication should look the same and it should look familiar to you. And if it doesn't look familiar, stop there and say, hey, I think this medicine's different than the one I was taking before. Has the brand changed? Is there something different? And get that checked out before you go home and take the medicine. Make sure it looks the same as the medicine you were taking before. A few other questions. You can always ask the pharmacist, look, I think I know how to take this medicine. This is very important, especially if you're getting treated for an infection or you've just been to an urgent care and emergency room or you've gotten a new prescription for something you've never taken a medicine for before. You may well know, and the physician may have explained to you very clearly, take this medicine once a day with food. The physician may have said that or may have not, but maybe something got translated differently on the prescription. We do electronically prescribe now, and sometimes errors happen. So always ask the question, I think I know how to take this medicine, but can you tell me what the instructions are? And what that does is it validates for you the instructions the physician gave you, and the pharmacist can reinforce them. And then if there's a difference, you can pick up on it quickly and be able to resolve those differences. You should always ask, can I take this medicine with food, or do I need to take it on an empty stomach, and what time of the day should I take it? Very important. You should also ask if there's any food you should avoid. For example, here we are in Southern California. Grapefruit is very fresh here right now and very popular. And guess what? Grapefruit interacts with a number of medications that can actually make your medicines toxic, certain medicines that you take. And then lastly, are there any over-the-counter supplements or dietary supplements that I need to avoid? It's very important to ask that question. We all take over-the-counter medicines from time to time, from everything from a cold for pain, or maybe we're taking dietary supplements to help make us feel better or stay healthy or have energy or whatever reason. So we always want to ask, because these are medicines you're putting into your body. They're medications. They're synthetic material for the most part that are designed to alter your body's function so that your body functions normally. They can be dangerous if they're not taken correctly, and so it's really important that you advocate for yourself, especially in community pharmacy practice, to ensure your pharmacist is looking out for you. Now, I also want to mention, because This picture is an important one. This is a familiar face, hopefully, to you on this picture. This was me earlier in my practice as an ambulatory care outpatient pharmacist. I used to work in a clinic with a physician on a regular basis, and I helped that physician ensure that the medications that we were using in that particular clinic were doing what they were supposed to do. And sometimes we had people who were taking lots of different medications. We had to make sure that they were working like they were supposed to. We spent a little extra time with people in that clinic on helping people understand their medicines, and I had a great interaction. We're now learning in the healthcare system that having pharmacists embedded in physicians' office practices, working right alongside with the physician, actually improves outcomes. We've even seen here at Loma Linda in our own diabetes care clinic that having pharmacists involved in helping patients with their medication therapy right at the point of care with their physician lowers blood sugars. That is a great thing, and that improves the outcomes that all of us experience associated with our conditions. So this is very important. You should also ask your pharmacist, what do I do if I miss a dose? It's really important to ask that question with antibiotics and other things that you're taking just on a one-time basis, and what to expect. What should I expect from this medicine? You know, there are certain antibiotics, for example, that can increase your risk of a sunburn. And if you're taking those antibiotics in a very sunny climate, then you might have to alter how you're exposed to the sun. And then always ask your pharmacist, how do I know if this is working? Some medications don't make you feel any differently if you're treating something like cholesterol or blood pressure. And sometimes the medicine might make you feel worse for a short period of time, but then you feel better after you've been on it. And how long will it take to work? A very important question. And then always ask, is there any increased risk of infection? We always want to ask about that. And do I need any vaccines? Your pharmacist can help you with that as well. So to end up my part of the presentation and take some questions from all of you, I want to first share with you just a real quick summary video, and then we'll take your questions.
We're pharmacists who are passionate about making your health a top priority because we're people who care about people. It means really getting to know you and mapping out the best solutions for your health. It's being accessible whenever you need us, wherever is most convenient. It's working with the other healthcare professionals who know you best to provide you with a top healthcare plan. It's using a vast knowledge base to give you advice on health issues extending far beyond medications, like detecting dangerous symptoms and suggesting timely interventions. We're here to help you live your healthiest life. We're your pharmacist. Accessible, knowledgeable, indispensable.
Well, I hope that you all have learned some new things tonight and have found this to be a helpful evening of information. And I'll ask Dr. Moses if we have some questions I might answer.
We actually have a number of them, so let's just get to it. One of the questions we have here is, do pharmacists ever override the physician medicine prescription?
Well, that's a great question. Now, pharmacists don't independently override prescription medications or overrule the physician's decision. Pharmacists work closely with physicians to make sure that the right medicine at the right dose is provided to ensure the outcome that the physician was hoping when they designed the treatment plan. So we work very closely with the physician to make sure that the medicine is the right medicine at the right dose. Sometimes there are changes, so maybe what you were initially prescribed may not be what you wind up with, but I can promise you that that's with the full discussion and consult with the physician. That's not a decision that the pharmacist is independently making.
But they're part of the team, and they make
Absolutely.
a team decision.
It is a team decision.
Mm-hmm. Another one here, this is an interesting one. I want to fulfill my prescription in another country to get it cheaper. Is that okay?
Well, I will tell you that's a big conversation right now in the U.S. of should I get prescriptions filled in another country or overseas. I think there's a lot of risk associated with that. Counterfeit medications are very common in other parts of the world, including just to our south. There's a big problem with counterfeit medications. And we have to be cautious about that because if you're taking something that's not what you think it is, you may not get the result that you were hoping to get. In other cases, there are other countries that have the same drugs that we have, and it's labeled the same and made by the same people, and it's perfectly fine to do that. I would just say that you really need to proceed with caution, that is a very risky thing to do, and you need to be very cautious as a consumer about getting prescriptions filled elsewhere.
We have another question, and that is, should I always have a pharmacist consultation every time I pick up the same medication? You talked a little bit about this.
Well, you don't have to spend a lot of time when you're going in to get a refill and it's been something you've been taking for years. You don't have to spend a lot of time with the pharmacist. But even when I go into my pharmacy, I know my personal pharmacist, and I ask him a question every time I go in. I make sure that I make eye contact with him, and I always make sure that he sees that I'm there. No, you don't have to have an in-depth conversation, but anytime you have had an annual visit, so maybe you've had your annual physical, and maybe your physician has renewed your prescriptions for another year. That's a really good time to say, hey, it's time for me to have my 1-year conversation with my pharmacist too, and ask your pharmacist if they could do a comprehensive medication review for you once a year. Many insurance companies actually cover as a benefit under their insurance plan a once-a-year comprehensive medication review. And so ask your pharmacist, does my insurance cover an annual comprehensive medication review? That's a great time to think about that kind of a thing.
A follow-up question to that. If your insurance covers that, is that something you have to ask for, or is that done yearly? Do you ask your physician? Do you ask your who do you ask?
Yeah, you need to ask your pharmacist for it. It's not something that necessarily will happen automatically, but you need to ask for it to be sure that you can get it. Your physician can refer you to a pharmacist to receive a comprehensive medication review, and that's certainly an option. But ask your pharmacist, and I'm sure that they will be happy to provide that service for you if you just ask. It may require, I will just be upfront, it may require a copay for that visit, because those comprehensive medication reviews, depending on the number of medicines you're on, may take a pretty lengthy period of time to conduct. It could take up to 45 minutes to an hour to be able to spend, but it's a time well spent, especially if you take a lot of medicines.
Okay. Well, we have one more question that we have time to ask, and it is this, does how far after the expiration date can I take my medication?
That's
interesting.
That's a fantastic question, because there's been a lot of discussion about that recently. So when a pharmacy dispenses a medication to you, on the label, there's going to be an expiration date on the label that's going to be 1 year from the date that it was dispensed. Okay, that is a general expiration date, because we know that those little amber vials that you get your medication in can only keep light and moisture out of the bottle for so long. And then after a period of time, your medicine's going to naturally degrade, and it's going to lose its potency. So in those little amber vials. In a pharmacy, the medication that comes in a stock bottle from a manufacturer is going to have a different expiration date, because that expiration date is the date under good storage circumstances in a light protected bottle with an airtight cap that those particular medicines will last, and they will last for quite a long period of time. So the answer to the question is not very specific. The answer to the question is, it depends on where you store your medicine. If you keep your medicine out of the reach of children, but in a cool, dry environment, like in a bedroom on a high dresser, or some area of that nature, instead of in a bathroom medicine cabinet. Bathroom medicine cabinets are terrible. They're the worst place in the house to store medication, because the humidity in the bathroom is always high, and then it's low, and then it's high, and the moisture builds up, and you actually lose potency in your medicines faster when they're stored in the bathroom. It would be much better if you store them in a cool, dry environment, like in a bedroom. It's much better, but be sure to keep them out of the reach of children. That's really critical.
Okay, now that's really important, because they call them medicine cabinets, and we put all our medicine in there in the bathroom.
That's
so
right.
we have some things to do when we go home. Well, thank you so much for being here. This has been very
you.
informative.
My pleasure.
And I want to thank you for being here as well. And I want to ask that you join us for next month's Wellness Live, where we'll be talking to Dr. Sherzai, and we'll be talking about Alzheimer's disease. You are at a great place here at Loma Linda for your trusted source for health information. My name is Dr. Olivia Moses, and I hope to see you next time.